A lot of people watching this video may recognise this feeling. When you wake up, the knees feel stiff getting out of bed. The first few steps may feel awkward in that area. Going downstairs, if you have stairs, may feel uncomfortable. And sometimes you might just have like that weird feeling in your knee that's a bit sore. After a few minutes, the knee usually loosens up. The stiffness eases and any mild discomfort often settles as well. This is very common and it doesn't automatically mean that something is damaged. So what happens overnight when we sleep? During your sleep, your body is very still, of course. Joints aren't moving, muscles are inactive, circulation slows slightly, and the knee stays in one position. Because the knee hasn't been moving, tissues can feel tight when you first stand up. This can sometimes come with like a mild aching, dull feeling if you've ever had that before. But once you begin moving, things usually start to ease. Your sleeping position can also influence the way your knees respond. We may sleep with knees slightly bent or straight, or you might have pressure through one side if you like to sleep on your side. So when you wake up for the first time and the knee may feel restricted or it might feel slightly uncomfortable, as you move, circulation improves, the stiffness and discomfort may settle. So let's look at stiffness versus ongoing pain. There's an important difference here. Situation 1, you're stiff first thing, you have mild soreness, but it improves once you start moving. This often suggests stiffness from inactivity. Now let's look at situation 2. The pain continues when you walk, worsens through the day, and it doesn't ease with movement. This may point towards other factors. However, this still doesn't necessarily mean something's injured, but if you're unsure, please go and seek a professional's advice. People often notice stiffness after busy days as well, long periods of standing, lots of walking, physical work, or exercise. The knee may simply be recovering from all of that. It may be stiff and it might have slight soreness, but they're often temporary. That's the most important thing to remember. You may be asking the question, what helps? So start with gentle movement, slow walking, light knee bending, and just try and increase that range of movement in that area. This improves the circulation and can help reduce the stiffness in the knee. Avoid jumping straight into activity, not literally. Try not to go straight into heavy tasks. Instead, why don't you try and walk around first, move more gently and stuff like that. Let's let the knee begin to loosen naturally rather than trying to force it. Some people find a light support helpful as well. They provide compression, reassurance, and a sense of stability. This may help reduce that stiffness that you're suffering with and any mild discomfort earlier in the day. And if it gets better as it goes on, you can take it off. But remember, they're used alongside movement, not instead of it. It's important to consider seeing a professional if you have symptoms that last a long time, worsen over time, include swelling, or cause locking or instability. Go and get checked out by a professional if you've got any of those. To summarise this video, morning knee stiffness and mild soreness in the knee are very common. They're often linked to reduced movement overnight, not injury. So try gradual movement, gradual loading, and sensible support. All those things can help make mornings more manageable.